BOC Social Services Annual Update, Mr. Santa Coloma and Ms. Rogers.
Good afternoon, and thank you for this opportunity. I'm more than sure that you know my name, but for those who don't know me, don't know my name, I'm Juan Santa Coloma, first Vice Chair of the Department of Social Service Board in Chesterfield-Colonial Heights. Today, I'm here on behalf of our chair, Mrs. Angie Green, who, of course, is not here because she has another thing, but I'm sending her the best. I'm delighted to be here before you this afternoon, and on behalf of our board, I would like to express our profound gratitude to you, and also because your support is important not only for us as a board, but also for Kiva and all the staff on the Department of Social Service during the past year. Your support is invaluable and integral to our operations. Our board provides administrative policy oversight for the department that helps and assists individuals, families, and our community. The goals are encouraging self-sufficiency, preservation, restoration of families, and protection of children, people with disabilities, and our senior citizens. Our board firmly believes that our work is of utmost importance to our community, and we are deeply appreciative of the vital role that you, the Board of Supervisors, play in this. Your support is a testament to our shared commitment to the well-being of all our community. Serving on our board, we have, of course, Mr. Ingle. Mr. Ingle, your representation of the Board of Supervisors has been invaluable. We are grateful for your support, your service, and your expertise. Also today, we have here from Chesterfield County, James Payne. Thank you, James. We also like to thank Dr. James Worsley. Dr. Worsley, you're representing the county administration. Your continued guidance and support are deeply appreciated and have been instrumental in our work. Today, our board would like to brief you to the successes and challenges of the past year and the new adventures and future opportunities we will have. We have asked Kiva Rogers, our director, to come and present this report to you. But before she comes, I'd like to say a little things about Kiva. Kiva has served as the Director of Social Service Department since 2016 and has led this department excellently over the past 8 years. She's a leader with vision, a heart for her employees, and a deep commitment to providing effective and efficient services for our customers. We are incredibly fortunate to have her as our director. Working alongside with Kiva is an exemplary team. Danica Riggs, our assistant director, Eugene Walton, Karen Riley-Jones, and Richona Addison. They each have extensive experience and expertise. This team, along with Kiva, is second to none in Virginia. The work of social service is demanding, stressful, and often heartbreaking. This team tirelessly works to create a culture of health, care, and integrity among its staff and the communities in Chesterfield County and Colonial Heights. Our board is privileged to work alongside it in a small way. Thank you for your time and your support. And now I want to invite Kiva to make her presentation. Thank you, Kiva.
Thank you, Juan. Chairman Holland, members of the board, Dr. Casey, thank you for the opportunity to share on behalf of our Social Services Board. This is my ninth presentation to you all as the Director of Social Services. And while it's almost a completely new board from when I started, both the Board of Supervisors as well as Social Services Board, there's one thing that has not changed in either board, and that is your commitment to public service, your support of this department, your guidance, and the high bar that you set for us. And so I'd like to thank you for that. I'm often asked, what keeps me motivated or grounded over the last 23 years, having the opportunity to serve the citizens of Chesterfield and Colonial Heights with the Department of Social Services. It's our mission. Our mission has kept me focused and grounded in the work that's important. It's a beacon of hope that keeps a reminder of why we are called to do the job that we do. And that is a belief that we strive to instill in all of our staff. There's a quote that often comes to mind when I think about just the mission and how we can help you to serve some of Chesterfield County's most vulnerable citizens. And it's an Ernest Hemingway quote. I get these quotes like from Dr. Casey. He gave the green light to use quotes. But I'm a quote person, and the quote says that the world breaks everyone, and many are strong in the broken places. At Social Services, we serve individuals from all races, socioeconomic status. What we know is that life happens to us all. And so our staff are called to serve people who have never had to use our services and life happened. Whether it was a catastrophic medical condition, a loss of a job, a divorce, abuse and neglect, exploitation, our staff have to be flexible to serve the person who's reaching us for the first time or the person who has needed our services throughout their life during those broken times that they've experienced. And so everything I'll share today is only accomplished through the amazing team that we have assembled who really wholeheartedly believe in the vision of the county, the values that we embrace, and the mission of our department. I do have some staff who are here, so I just ask that you stand up. Some of our frontline staff, Matthew Williams and Eileen Fields and Jonathan Penn, and our executive team is also over there. It's truly because of them that we are able to accomplish the things that we've accomplished. And so I wanted to start off with just highlighting the workforce, because everything else that I say, as I said, is going to be because of our workforce. Just wanted to highlight a few things. We had 2 staff who were selected to be part of the VCU Child Welfare Addiction Fellowship Program. This program provided significant training and development for our staff. It helped them to close the gap in some of the knowledge of, best in practice substance abuse treatment. And so it's a 2-year program that they were selected to participate in, and they bring all of that knowledge back to our department to help equip our staff with dealing with the impact of substance use disorder, which for our department, we have seen the impact of the opioid epidemic and things as it relates to child abuse, child protective services, as well as foster care and the prevention efforts that we have. I also wanted to highlight that we received a $20,000 grant from an effort that we were selected. The Virginia Department of Social Services provided our name as a department to reach out to from the Children's Bureau and the Center for Disease Control. Our staff participated in reviewing some never-released training and best practice to help child welfare professionals recognize fetal alcohol exposure and the impact that oftentimes we work with kids and we may see that they're diagnosed with autism or ADHD, and sometimes if our staff are not skilled and equipped to be able to see below the surface that maybe there is something there, we may miss it. And so this valuable training and the resources allowed us to have some firsthand knowledge of new information that was coming out. And so we're excited about that. The staff dedicated a lot of time in addition to what they already do to review training that will help the entire system in the United States because it was through a federal program. Employee well-being, I was listening to Julie's presentation and just about the importance of, employee well-being. I just stated everything that our staff have to work through throughout the day, just the things that we see, being oftentimes called to be of service when someone is experiencing probably the most difficult time in their life. And so one of the things that definitely helped our staff to feel heard, seen, and supported was each one of you came through our department and toured our department. That does volumes for our staff, and I just wanted to thank each one of you for taking the time out to be interested in our work, to see the value that we add to the county, and so that goes a long way to help supporting our staff and their well-being and engagement as well. Kelly Free, during her presentation last month, I won't go too much into it, talked about the secondary traumatic stress NACO award that was won on behalf of Human Services. Our department was a part of that, and so we have continued those efforts that were identified through our work with the University of Kentucky. We have a trauma-informed leadership team that has done a significant job of trying to infuse trauma-informed things into our day, again, to just help the staff. We also partnered with Clover Hill Church to create a space for new moms. We have many new moms in the department, and so we created a new space. They donated just about everything in that room to make it inviting and just to give a nice place for them to nurse or to pump. I didn't think to say pump. Okay. We also added for the first time in our department, we have an HR administrator. Our department is a large department. We have over 140 employees and never had a human resource administrator. And adding that position that's focused on really our workforce, supporting them, identifying ways to just address employee morale, make sure that our staff have what they need to do their job. Training is such a big part of that. And so Rashana Addison, have to apologize to Mary Martin Selby because we borrowed her. We took her from county HR, but it's been just a really good addition to our department to have a leader that's solely focused on helping with the workforce. And that position I've added to my executive leadership team so that that perspective is always at the table as I'm called to lead the department. And so I wanted to just highlight a little bit about the demands that our staff have been under. You'll see that we've had an increase in walk-ins as well as a 30% increase in calls. We've had a reduction in the more virtual ways that people can access us through our email, DSS Docs email option. That was something that was created during the pandemic as a way for us to streamline services. It's continued. It says a decrease, but 72,000 is a lot. But we had over 116,000 calls that came in and almost 28,000 visitors. I'll talk a little bit later about some of what contributed to that. The term that I know I have said before is unwinding. Contributed to a lot of that, and that was the changes that happened as a result of Medicaid unwinding after not having to do renewals for since March of 2020. In our customer demand, we've seen a significant increase in our Spanish-speaking population, and so we have increased staffing. Staff who are bilingual are trying to leverage technology as a way to be able to communicate with customers. Technology really has been an avenue that we're pursuing because while Spanish is the predominant language, we're seeing more and more languages. And so the more nimble we can be to offer a variety of language options, the better. So we're working with County IST to be able to be able to serve folks who have different language needs. I'm going to frame the work that we've done this year using the same lens that the group that presented initially used, which is the economic mobility lens. I am very grateful for the opportunity to work with the Bill and Melinda Gates Foundation during that grant process. I remember when Dr. Casey, I think I've said this before, so it's a little joke. He sent a grant notice. I think it may have been due in 3 days. Yes. But Dr. Casey wanted us to participate if we could. And just knowing how, this is a sidebar, but just knowing how Dr. Casey sees the lens of human services in everything that the county does. So whether it's in economic development or building new homes, he always thinks of us and how we can be a part of the solution and making sure that whatever we do focuses on that lens. So when Dr. Casey sent it, we were like, of course we're going to try to make this this deadline. But it was really easy to write the grant because if some of you may remember, the Committee on the Future report for financial independence for all residents is exactly aligns with the work that was done. Some of the questions in there were about what has your locality done to address some of these things. I could go back and look at, all the work that the FIT team at that time, Financial Independence team had done. I had the opportunity to lead that group with Kelly Freed. And so this work, what I'm going to focus on are a couple elements of it, but the county has already been leading the way in these efforts during my time here with the county. So I'm going to focus on food, healthcare, income, and shelter. I really could touch on every aspect of the model because there's a role for social services in each of the areas. I'll start with shelter. And my partners who were at the table, I feel like I need to get them an office at social services because we truly do collaborate a lot. This image is just something that I created to kind of help us focus on the impact and opportunities that we have to effectuate change as it relates to housing and security. The work that we do and the general fund money that you give us to help people who are experiencing crisis, I see all of that as helping to prevent homelessness because when folks are unable to pay their electricity bill or things of that nature, it will not be long before they may not be able to pay their rent. And so whatever we can do during that time, again, embracing a transformational model and not a transactional model, you may come to us for an electricity bill, but we're going to also see where are some threats that are coming down the road. How can we help you to figure out how to best budget this money? Jonathan Penn, who's here, his team does an excellent job in working in the community to try to find resources for residents. And so when I talk about housing, I'll look at it from a preventative perspective, which the group before me talked a lot about, as well as some of the things that we do to help get folks into permanent housing. And so over the last year, we served 715 individuals who were at risk of losing their home in FY24. It is through the collaborative efforts working with ACTS that Javon mentioned and all of our community partners that we were able to do some really good preventative work in trying to keep people from crossing over into actual housing loss. We like hearing about things that are on the preventative end. Social services, it is so much easier to I say easy, but it's still very complex, hard work. But it's so much easier if we can be preventative because once somebody gets an eviction on their record or back bills, it is so much more expensive, not just financially, but emotionally for the individual. So that's my soapbox. I can go on that all day. But we also administer a variety of utility assistance programs, whether it's Dominion Energy Share, energy assistance program through Department of Social Services. And there's a new program, the Percentage of Income Payment Program, where it helps individuals to have a fixed utility bill to help. It's a percentage of their income that's used to kind of fix their utilities. Again, just trying to help folks from experiencing either a loss of utilities or homelessness. The $300,000 investment that the county made in continuing our eviction prevention efforts has been tremendous. I think we were knocking on everybody's door. When is that money going to get there? When is that money going to get there? Because the need was there. And so I thank you all for continuing the investment in helping individuals from a preventative perspective to try to, assist. And so on the more permanent efforts to try to find permanent housing, we work with, it's a SPRINT team, which is the strategic planning for individuals in need or transition. You've probably heard about that. Police department, mental health, emergency management are all part of that team. It's a very collaborative group where we put our heads together to try to find solutions for individuals who are challenged. And so we're at the table offering resources, strategizing ways to assist. We administer the Housing Choice Voucher Program, where we served 448 Housing Choice Voucher Program participants. We are not a public housing authority. We administer those vouchers on behalf of Virginia Housing. And so we work very collaboratively with them. We recently had a meeting with their leadership. Some of you, Mr. Holland, I know was there, I believe Dr. Miller, were there, really trying to help shape the services that are provided to individuals who are participating in the Housing Choice Voucher Program. One of the things that we aim to do in our department is to have participants of the Housing Choice Voucher Program, although they are not technically served through the Virginia Department of Social Services, but have them exposed to all the resources that we would provide any resident who is receiving services. And so those are some ways that we have worked in the more permanent housing space. The money that additional $300,000 that was given to Housing Families First and Bringing Families Home program, I'm very excited about that and the difference that will make. That idea came from Kelly King Horn. As they mentioned, I'm on the Greater Richmond Continuum of Care. Kelly King Horn is she's a networker and very, very knowledgeable about the housing space, but she worked with community enhancement, started some initial money, using some initial money from the COVID funding, and we were able to really see the impact. When we began developing and building the program, we took into consideration a seed that had been planted the year before the pandemic by Dr. Casey when we were looking at kids who were receiving McKinney-Vento services. And so this was a program that was built on just intentional effort to address a county priority, which was how can the county help the schools with addressing the housing needs of kids receiving McKinney-Vento services. So I think I was like, every meeting I could go in to say, where can we get money to continue this effort? Because it really has been extremely beneficial for our families. Most of them are living in hotels, and we know the impact of that can have on kids and their education. So really excited about the efforts to support in that area. So I'll move on now to the employment area. We, 2 years ago, became a SNAP Education and Training Department where we can provide additional services to individuals receiving the Supplemental Nutrition Assistance Program if they participate in some job skills and training. The effort is to increase their household income. And so this year, we did have an increase in participation in the SNAP program. We served a total of 40 customers that came from benefit programs, and 55 customers were self-referred. So these are customers who were reaching out to us wanting assistance to participate in the program. Some of those customers were considered what we call ABOS, are able-bodied without dependents. We saw individuals from who were being served through the refugee program, as well as just folks who just came to us asking for assistance. So you know that we offer an employment center, which is not something that every social services has. We offer the same employment services that we give participants in SNAP or the VIEW program. Any Chesterfield County or Colonial Heights resident can request those services, and so we had some folks who participated in that. What we did find was that an average increase in wage, there was an average of 19% increase in wages for those folks who participated in that program with us last year. And so the numbers, we also hosted our first career and resource fair since the pandemic. We used to do those a while back, but we did it in partnership with the county's workforce development group. And so we're really excited about that and getting that done. And this is the Matthew hour because Matthew is the leader. Matthew's position is really we have it because of this board. You all created a position for us several years ago before we became a SNAP ENT agency, which meant we had some resources attached to us. You all funded a position when we asked, could you give us a position to try to be able to support individuals who are receiving benefits, and you did. And so now that position has grown to where Matthew's position is solely focused on working in the community, working with economic development, finding out where the jobs are coming, who can help us with finding jobs. We have people who want jobs. How can we help them to make the connection? And so that is a asset to us. And again, it's not something that's in every department of social services. I also wanted to highlight just some childcare updates because we know the impact childcare has on working families. That starting in July, we did start a wait list, and it was so the childcare program was expanded during the pandemic. A lot of resources, again, through COVID funding, were used to expand the childcare services. In an effort not to lose all of the success we had garnered from kids getting into childcare programs, the governor came up with a great plan to really save the childcare program. It had grown significantly. The plan was multifaceted where a lot of different things changed, but one of the things that was put in place was we began to have a specific amount of allotment of childcare cases where we had eliminated the wait list. We started a new wait list July 1st, and so we're continuing to monitor that wait list and move families off and on as quickly as we can. But we were able to, before July 1st, we received over, let me get the number right, $861,000 from the state. Our staff worked tirelessly to get as many kids approved for childcare before the wait list started. And so we were given an additional $861,000 to get our kids into the childcare program. I wanted to show just a quick impact story because the numbers may seem small with the work that we do, but we are oftentimes working with folks who have multiple barriers. And it is through the engagement of our staff, the skill of our staff, the partnership and collaboration that we are able to help some folks who are probably have had the most challenges. And so one is a SNAP education and training success story. It is a customer who was actually referred to us by Brightpoint. We have a partnership with Brightpoint where not only do we send our VIEW participants, but also if they're working with individuals, Dr. Miller just perked up. That was not intentional. But they referred someone to us whose long-term goal was to become an attorney. But he knew that he needed to bite that elephant one bite at a time. And so he went through the CDL program through our SNAP ENT program, we were able to help support him in his efforts in getting his CDL. He was very committed and determined. He never lost sight of his long-term goal of being an attorney. But what we were able to do in partnership with Brightpoint and using our resources was to help him to get a job before he finished the class. He was able to use his CDL, and he knew that that was important to be able to put that credential to work as soon as possible so he could take care of his family. And so he got a job. We helped him to go out of state to do the training and to get all the things that he needed to be able to start employment. I think you take it for granted sometimes. When I start a job, I just show up. But there are jobs where you have to pay to get certain equipment before you can even start. And so we were able to make that job a possibility, a reality for him through the through the SNAP ENT program in partnership with Brightpoint. The other is a success story with our VIEW program. It's a family that was participating in the refugee program. They were transitioning from the initial refugee program to our VIEW program. The programs are different. The initial services, you start off with a ton of supports, but we were part of the weaning process. And so it was a family where there was a mother who had some medical issues. They did not speak English. They did not have driver's license, didn't have a car. I want to fast forward to where we are today, where there was some initial barriers. I won't call it resistance, but there were initial barriers with helping the family to understand the difference in requirements in the program. Our program has participation requirements. There are things you have to do to maintain your resources. This family is now, both of them have jobs. They both have driver's license and a vehicle. And the wife, who had some medical problems, has a sewing business. She learned the trade of sewing. And so that's just two stories that really, I think, epitomize the work that we do and how the relationships is so important with the work that we do. So the numbers may be small, but the impact on the lives of those, it reminds me of the starfish story. It really makes a difference, not just for them, but for the trajectory of their family. And so I did want to move on to healthcare and talk a little bit about unwinding. I've jokingly called it unraveling, but we have gone through and processed the Medicaid renewals. We had over 24,000 that were overdue. That was a huge part of the increase in telephone calls. That it was a very confusing time for not only staff. We started and paused because the state didn't want to remove too many people too soon because maybe we had the wrong address or something like that. But, it's through the heroic efforts of staff and just persistence, the community for being patient and really trying to communicate that we were able to get through unwinding. And so now we're trying to get back to what the new norm will be for us with Medicaid. Also in the healthcare space, I just wanted to highlight in FY24, it was a slight decrease, but we had about 90,000 Medicaid assistance recipients, and we also had a 30% increase in applications. What we were finding was as people were losing coverage, many of them would reapply to hopefully regain their coverage again. So we're anticipating that leveling out and over the next year being able to see what our true Medicaid workload will be. So I'll go to food. I'm not going to spend much time here because I was here a couple months ago. And we're really focusing on the seniors right now, we're expanded a program with the food bank through the CDBG funding. And we're also creating a group here locally with government and nonprofits to really look at seniors and how we can address food insecurity with our seniors. The next thing I wanted to highlight was we did have an opportunity to go to Oregon I was supposed to present in August, but I had to, you guys graciously reschedule so that we could participate. But it was a great opportunity, not only to share, to hear others, but also to share some of the ideas that we have been doing, some of the innovative ways that we have addressed economic mobility. We were also recently mentioned in a letter to the House Committee on Ways and Means to advocate for really the way that Chesterfield does the work. A quote from it talked about the way that we have created a really community-based approach to how we find employers, the work that Matthew is doing, how we try to find employers and do warm handoffs and things of that nature. So a lot came out of that group. We're now part of efforts to just participate on a federal level. One thing that I shared during the panel was really the connection and intersection that I see with this economic mobility work and prevention. And we see that through our child protective services and adult protective services, as well as how we have served children through our CSA program. Many of our kids who we're serving are also participating in the programs that I just spoke to you about. And so the better we're able to increase the financial standing of families, the more protective factors that kids have in the community. Likewise with seniors. All right, so I am going to end our presentation really on our mission and action. You'll see that I have, I always like to show this slide with a snapshot of a few of the community partners. Really, the work that we do, we could not do it if it was not in collaboration with each other, within our department, within the county, as well as with our community partners, the business and the faith-based community. Recently, I completed an interview with the innovation team at Virginia Department of Social Services because they're going around the state finding out how local departments of social services work with the faith-based community. So when Mr. Holland said that about the faith-based community, my ears perked up because we were one of two local departments of social services that were mentioned in their interviews as having a robust, positive relationship with the faith-based community. And they were shocked at that out of all the interviews around the entire state that we were one of two. And so they spent some time with us just hearing about our approach. I want to just end on one with the impact story. And this, I think, epitomizes the work that we do. And it's the collaboration. We were contacted by ROAR, which is the Route 1 Association for Revitalization. They were working with a gentleman who had been living in a hotel. They contacted us, wanted to do an intake with him. We got an intake that day, met with them. Fast forward, this is a gentleman who had been living in a hotel and had been described as just beginning a downward trend due to living in the hotel. And so we were able to work with them, we worked with the church who gave us some of the money. Axe gave us some of the money. He moved into an apartment. They worked with him to put an app on his phone to help him to track his spending. They worked with him to complete a application for SNAP so that he could use some of his resources to help pay his rent that he was going to be using for food. And I think that impact story just really highlights the work that we are able to accomplish when we're all working together as a community. And that's really the approach and the lens that we look at everything that we do. So thank you for your time. I appreciate it.
Thank you. Thank you both so much for being here, and thank you as well for any audience there. We appreciate your being here and outstanding things you're doing. You said so many great things, and HR admin and all the other stuff. Y'all doing great stuff. Keep up. Keep doing better. Keep pushing forward and pushing upwardly, because that's what we like in this county, excellence. Thank you.